Okay, so we've been dealing so much with the wound on the other foot that we forgot to get your nail care in there, right?
Mm-hmm.
Okay, so this has been about 4 months?
Mm-hmm.
Okay, so these little toes look really good. There's not much to cut at all, but you left me some really good ones on the other toe.
You like that?
I do.
Oh, I'm so happy.
To get these cut?
Yes. Look at that one.
You grow them well.
Not anything I'm excited about. Look at that one. That's really long.
Yeah.
It's gross. Looks like Duvilla.
Like what?
Duvilla the witch.
I don't know who that is.
Well, the witch with the 101
Oh,
Dalmatians.
Cruella de Vil.
Cruella de Vil.
Cruella, yeah.
I was making a combination of her first second name.
And it looks like this one grew out and then over here it just broke.
Oh,
So we only got a piece of nail. So I would bet this one has been snagging on a lot of stuff.
oh. I wish the swelling would go down. It's very uncomfortable sleeping.
The swelling, you mean in this foot?
Well, actually, both. This one is swollen too from when I injured that foot. And I've been doing this to it.
Mm-hmm. I'll come back and we'll clean all this up in here.
Doesn't hurt at all.
Good, because in the beginning
Yeah,
you were in, so yeah, it's mostly healed now.
it doesn't hurt. So I have to wait for that upper scab to close, is that it?
I want the entire thing closed before I release you back into a shoe full time.
Okay.
So if you've got something special tomorrow and you need to be in a shoe for 4 hours, you know, that's not my first choice, but we'll get you back into the surgical shoe after.
Yeah.
And we just need to keep the pressure off. It's healing so well now that I just don't want anything to jeopardize that.
No. I'm getting good at doing it.
Putting the dressing on?
Yeah. I have to put my foot on the floor and bend down. What's that you're doing?
I'm just trimming off all the dead stuff.
Oh, there's dead stuff on there?
Mhm.
It does hurt up there.
Up in here?
Yeah,
This is the part that's still open.
yeah. Not a lot, but just a little now, it doesn't hurt.
Now, I'm taking this piece that was sitting on it like a scab.
Mm-hmm.
I'm taking that off
Mm-hmm.
because then that will help it heal from
Okay.
deep to superficial.
Okay,
So,
okay.
Good. Yeah.
Remember when it was opened all the way down to the bottom of the toe?
I do, and you had a, yeah, it was open a lot. So this is all actually new skin.
Okay.
This right here
Mhm.
is the only part that's still open.
See, I can't see it.
Right, and so that's why you're gonna keep dressing it and
So I don't
covering
need
it.
to do the whole toe.
Well,
I can just
no, I
do
will,
the half of the toe.
right. So you need to continue to keep the bandage on from here up to
Right,
here.
Right,
Yep. The rest of this is all healed in.
okay,
So it's looking really good.
okay. Oh, I'm so happy I had my nails cut. I've never been so happy before. Oh, they look like real feet. You know, my kidney doctor, Dr. Leither,
Mm-hmm,
he said he knows Dr. Vandy very well.
mm-hmm.
They have like
Good old boys club?
a, I don't know. And you know Dr. Vandy very well.
Yeah.
Because he told me he had lunch with you, and you told me you had lunch with him.
Mm-hmm. You know, when you find good people to work with, you tend to want to stick with them.
Yeah. Well, Dr. Leither also is very good. And my kidney is down to normal.
Really?
The potassium is to normal.
That's wonderful.
But my blood sugar, because I had that shot on Friday,
What kind of shot?
in the back,
Cortisone?
yeah.
Yeah, that'll raise your blood sugar.
How long does that take, do you know?
For the cortisone to take effect or for your blood sugar
No,
to
for
come
the
back
blood
down?
sugar to come back down.
You know, it's very different. Usually it's a few days.
Because it was doing really well Friday and Saturday, and all of a sudden it started going up again.
It may not have anything to do with the cortisone shot. Have you been,
No, I haven't
taking-
been naughty.
okay. Yeah, I don't know.
Yeah.
You could call and talk with your primary care doc about it, but
Well,
usually,
I'm being careful, I'm just gonna see what happens.
okay, I'm gonna put a little antibiotic on it.
Yeah, that's what I do.
A little bit of antibiotic. And then after I lotion, I'll put the rest of the bandage on there.
Okay. Would acupuncture help the swelling at all? Could it?
It could. It certainly can't hurt.
I should ask Martin to do some acupuncture.
He does acupuncture.
He's an acupuncturist.
Oh, okay. Yeah, it certainly can help. You know, with acupuncture, the whole idea is to get the chi flowing, and
Right.
if your blood's not flowing, then,
Oh, it should be flowing now.
I mean, it's flowing, but if it's getting, you know, kind of stopped up, and just a piece of tape over that.
Yeah. Oh, that's, so I don't have to worry about getting it around the toe.
Right, we've just been doing it like this, right?
No, you were wrapping the telfa around the toe.
Like that?
Yeah, that doesn't matter, you don't have to do it that
Yeah, the
way.
whole idea is just to keep it covered so that it'll keep the antibiotic on and keep the bacteria out.
Yeah,
I am gonna put one around here a little bit. But it's looking really good. I'll add in some of the pictures of where we started to give the people watching the video an idea of what it looked like when you first came in with it. And then there we go. It's not beautiful, but it works.
no, it doesn't matter.
Okay. Well, thank you for letting me video.
No, you're welcome.